Codes with the highest number of COVID cases in Dallas County have a few things in common: higher poverty, less access to health care, and a lot of Black and Latino residents. As Teresa Woodard reports, there is a real sense of urgency to turn this trend around.
You've probably heard COVID doesn't discriminate. It's true. Anyone of any age or race from any neighborhood could get sick. But certain neighborhoods are getting sicker.
We've got to have a sense of urgency, Teresa, right now about addressing this.
We need to do something.
Zip code 75211 has the highest number of COVID cases in Dallas County. And that's why city code officers are handing out flyers here, telling people how to help stop the spread. They'll do the same thing in 75216 next week. Poverty is high, access to health care low. These communities are heavily Hispanic and Black. So while the virus doesn't discriminate, life circumstances do.
Latinos, we are the ones in the front lines. When you talk about access to healthcare, we need to be sure that everybody, regardless of legal status, has access to healthcare. Because this virus is not going to ask you for legal status.
80% of health is related to social factors and only 20% genetics. And you would believe the otherwise, right? Because we hear a lot about genetics and less about the social factors.
Dr. Michelle Albert is president of American Black Cardiologists. She's working with the American Heart Association to research COVID in Black women, and she's finding an unmistakable link between health and wealth.
The root of all of this has to do with racism and segregation. So we have to dismantle those systems.
Repairing historic inequities is a long-term goal. Short-term,
We just follow the science, follow the guidelines,
no matter the age, the race, the zip code,
and we'll be just fine.
the goal is to save a life. In Dallas, I'm Teresa Woodard.